Hi, John.
Hi.
Hi, good. So it's now been 2 months since we did a procedure for you,
Yes.
and it was a pretty involved procedure, very aggressively invasive. Um, do you want to tell us your story, how it came about, and how it's progressed, and how you've changed, and the difference you feel?
Well, actually, I had no idea how much the the problem was dragging me down until it was repaired. Uh, I've been feeling poorly. I would probably say, when I think back on it now, for maybe 4 months, on and off. And I went to see my ENT. He didn't find anything wrong. Uh, but as it progressed, um, they did find that I had some redness in my ear. And about that time, it started to bother me enough to come back to see my dentist. And he found right away that I had a really serious problem. He explained to me what it is you were going to do, which didn't sound pleasant at the time, but the results have been absolutely wonderful.
So since the surgery, comparing how you used to be before and how you are now, what the differences?
I have more energy. I'm not as tired, and it, it definitely has improved my disposition. You can ask my wife about that.
So just to go over again, you actually had a very chronic infection in your sinuses, and because of that chronic infection, your ear was also infected,
Yes.
the ear canal, and it was all because of a tooth that had a root canal a very long time ago, and there was an infection, and a cyst that had developed around the root of that tooth.
Yes.
And on routine x-rays, nothing was really visible because routine x-rays inside the mouth are two-dimensional,
Yes.
and they don't really pick up a lot of stuff. But a good clinical exam, a good thorough medical history review, and symptom review really can tell a lot. And it was pretty, you know, pretty easy to figure out what the problem was once, you told me all your symptoms, and a very good thorough clinical exam was done. Plus, we had a CAT scan taken. We took a CT scan in the office. We have one. And from there, we were able to see in 3 dimensions the origin of the infection that you had been suffering with for such a long time. And then we fixed that infection and the cause of that infection. And it was pretty aggressive, involved surgery, with required grafting of bone and soft tissue, repairing of the sinus, that was damaged. So it was pretty involved, and you were sedated for it, so you don't recall anything.
No, thank
And
goodness.
thank goodness, right. And recovery was relatively uneventful. The sutures finally dissolved after about 6 weeks because we needed the tissues to be closed for that long.
Yeah.
And now the sutures have completely dissolved 2 months later, and the symptoms that you used to have of the sinuses are completely gone. The sinuses are clear, no more ear infection, because the source of the infection is
Well,
no longer there.
I also think I sleep better.
Right.
Uh, I, what happened initially, I think, when it got to the point where it really was starting to bother me, is I noticed that I had some swelling under this eye, and that was probably because of the pressure on my sinus. But I had no real pain from this.
Right. You
I
didn't
just
have
felt
any
sick.
dental pain at all.
No, none, zero.
Exactly. But that's the scariest part is a chronic infection can fester inside one's body without us being notified of it.
Sure.
And it requires a professional who really pays attention to the minute things, to the subtleties of things, to be able to decipher all the little clues that we get from an examination
Sure.
and put the puzzle together. And that's more of a diagnostic ability. And then being able to do the procedure based on the diagnosis is the key. It's the diagnostics that drive what we do.
Yeah.
Without a thorough, accurate diagnosis, the treatment that's performed is no good. It won't be. It will only be as good as the diagnosis that it's based on.
Right.
So it's important to really have a professional who really knows his stuff. Do whatever is required. And now there's no more sinus infection. The redness in the ear is gone. There's no more pressure underneath the eye, and you're sleeping better because the sinus, which was once filled with fluid, with mucus and infected fluid, was actually obstructing airflow, and because it was obtunded, there was not enough air being filled into the sinuses because it was occupied by fluid. Now that there is no fluid in the sinuses are relatively clear. They're an air-filled cavity. And there's a definite purpose for that air-filled cavity because it allows us to speak and resonate. It also allows the air passages for us to breathe. So if the sinuses are blocked or clogged, we don't breathe well. Now that they're free and clear, you have much more air going into your nasopharynx that allows that air to get into your lungs. So of course you're breathing better because you're now getting much more air into your lungs than you were before. So you see how it just compounds one thing onto another.
It's a puzzle.
It really is, and it's amazing how little things can really create big problems. And I'm just glad that you were trusting enough to allow us to do what was needed, despite of not having any pain, which is usually a call for help. Most of the times in the dental world, patients want help when they're in pain.
Oh yeah, I've been there.
Yeah, exactly. But when you're not in pain, you're not as receptive to want help because you don't perceive a problem. But when you have wonderful long-term patients who are part of the practice for decades because they believe in the practice, they believe in the doctors in the practice, because they have had the results of positive results and great care from caring individuals who really care about their patients' well-being more than anything else. So I'm glad that you're part of the practice, John, and I thank you so much for telling your story. And we'll just keep you healthy.
Well, let's hope that it'll just be preventative from now on.
Exactly, that's the way to do it. Thank you, John.
You're welcome.